Asthma. Also called bronchial asthma. A condition in which a person's airways become inflamed, narrow and swell, and produce extra mucus. Asthma can be minor or it can interfere with daily activities. In some cases, it may lead to a life-threatening attack. Asthma may cause difficulty breathing, chest pain, cough and wheezing. The symptoms may sometimes flare up. Asthma can usually be managed with rescue inhalers to treat symptoms, salbutamol, and controller inhalers that prevent symptoms, steroids. Severe cases may require longer-acting inhalers that keep the airways open, formoterol, salmeterol, tiotropium, as well as inhalant steroids. Asthma symptoms. According to the leading experts in asthma, the symptoms of asthma and best treatment for you or your child may be quite different than for someone else with asthma. The most common symptom is wheezing. This is a scratchy or whistling sound when you breathe. Other symptoms include shortness of breath, chest tightness or pain, chronic coughing, trouble sleeping due to coughing or wheezing. Asthma symptoms, also called asthma flare-ups or asthma attacks, are often caused by allergies and exposure to allergens such as pet dander, dust mites, pollen or mold. Non-allergic triggers include smoke, pollution or cold air or changes in weather. Asthma symptoms may be worse during exercise, when you have a cold or during times of high stress. Children with asthma may show the same symptoms as adults with asthma, coughing, wheezing and shortness of breath. In some children, chronic cough may be the only symptom. If your child has one or more of these common symptoms, make an appointment with an allergist, immunologist. Coughing that is constant or that is made worse by viral infections, happens while your child is asleep, or is triggered by exercise and cold air. Wheezing or whistling sound when your child exhales. Shortness of breath or rapid breathing, which may be associated with exercise. Chest tightness. A young child may say that his chest hurts or feels funny. Fatigue. Your child may slow down or stop playing. Problems feeding or grunting during feeding, infants. Avoiding sports or social activities. Problems sleeping due to coughing or difficulty breathing. Patterns in asthma symptoms are important and can help your doctor make a diagnosis. Pay attention to when symptoms occur. At night or early morning. During or after exercise. During certain seasons. After laughing or crying. When exposed to common asthma triggers. Asthma diagnosis. An allergist diagnoses asthma by taking a thorough medical history and performing breathing tests to measure how well your lungs work. One of these tests is called spirometry. You will take a deep breath and blow into a sensor to measure the amount of air your lungs can hold and the speed of the air you inhale or exhale. This test diagnoses asthma severity and measures how well treatment is working. Many people with asthma also have allergies, so your doctor may perform allergy testing. Treating the underlying allergic triggers for your asthma will help you avoid asthma symptoms. Asthma treatment and management. There is no cure for asthma, but symptoms can be controlled with effective asthma treatment and management. This involves taking your medications as directed and learning to avoid triggers that cause your asthma symptoms. Your allergist will prescribe the best medications for your condition and provide you with specific instructions for using them. Controller medications are taken daily and include inhaled corticosteroids, fluticasone, Flovent discus, Flovent HFA, Budesonide, Pulmicort Flexhaler, Mometazone, Asmanex, Siclesonide, Alvsco, Flunisolide, Arabid, Biclomethazone, Kvor and others. Combination inhalers contain an inhaled corticosteroid plus a long-acting beta agonist, LABA. LABAs are symptom controllers that are helpful in opening your airways. However, in certain people they may carry some risks. LABAs should never be prescribed as the sole therapy for asthma. Current recommendations are for them to be used only along with inhaled corticosteroids. Combination medications include fluticasone and salmeterol, Advair Discus, Advair HFA, Budesonide and formoterol, Symbicort, and mometasone and formoterol, Dulera. Leukotriene modifiers are oral medications that include montelukast, Singulair, Zafirlukast, Accolate, and Xyloton, Ziflo, Ziflo-CR. Quick relief or rescue medications are used to quickly relax and open the airways and relieve symptoms during an asthma flare-up, or are taken before exercising if prescribed. These include short-acting beta agonists. These inhaled bronchodilator, bronchodilator medications include albuterol, Proair HFA, Ventolin HFA, others, lavalbuterol, Xopenex HFA, and Perbterol, Maxair Autohaler. Quick relief medications do not take the place of controller medications. If you rely on rescue relief more than twice a week, it is time to see your allergist. Oral and intravenous corticosteroids may be required for acute asthma flare-ups or for severe symptoms. Examples include prednisone and methylprednisolone. They can cause serious side effects if used on a long-term basis. If you are pregnant, you may be hesitant about taking medications, including those for asthma. This can be a mistake for your health and that of your baby-to-be. Continue taking your prescribed asthma medications and make an appointment with your allergist to discuss treatments that will help you have a healthy pregnancy. Additionally, you may want to enroll in a study designed to monitor medications and pregnancy. People with asthma are at risk of developing complications from respiratory infections such as influenza and pneumonia. That is why it is important for asthma sufferers, especially adults, to get vaccinated annually.